Hello everyone, welcome to my 12 months progress report. My PhD thesis is microbiome modulation in chronic inflammatory skin diseases. My name is Gabriela Mohos, I'm a medical doctor and a PhD student at the Department of Dermatology, Semmelweis University. And our vision is to provide a better care for patients with chronic inflammatory skin disease with implementing the microbiome modulation. I have two ongoing projects. The first is about the microbiome modulation, and the second is about the topical calcineurin inhibitors. My first project is investigating the effect and safety of microbiome modulation in atopic dermatitis patients. Atopic dermatitis is a chronic inflammatory skin condition with itchy, red, dry, and irritated skin, and commonly known as eczema. In children, it is the most common chronic skin disease, affecting up to 20%, and in 3% in adults worldwide. So it's not just a skin condition, it's a major public health issue. Atopic dermatitis has a major impact in quality of life, and severe atopic dermatitis causing patient depression and experiencing suicidal thoughts or suffering from social stigma or isolation. So emerging evidence suggests that microbiome modulation could offer a novel and safer therapy. So our aim is to evaluate the efficacy and safety of microbiome modulation in atopic dermatitis. The question would be, is microbiome modulation effective and safe in the treatment of atopic dermatitis? To answer this question, we are focusing on probiotics, prebiotics, symbiotics, and postbiotics and antibiotics compared to placebo or the standard treatments, with an outcome of the disease activity, the SCORAD score, and the secondary outcome, the quality of life, or the adverse events. We hypothesize microbiome modulation is effective and safe in the treatment of atopic dermatitis. And if that's true, then we can implement in the clinical field, and AD patients would have a better quality of life and a controlled disease activity. We conducted the search in 3 databases, and from almost 12,000 results, we ended up 106 eligible articles. Let me show you my results. In the first figure, you can see the change in the SCORAD score in patients treating with probiotics versus placebo in an 8 weeks of intervention. SCORAD is scoring atopic dermatitis, and it is a validated tool to assess the severity of the disease with a range from 0 to 103. The higher score means the more severe the disease, and with lower score shows clinical improvement. You can see 14 RCTs in a total of 1,000 patients with AD, with a moderate of 69% moderate heterogeneity, and it can be maybe due to the difference in ages. You can see we selected the adults, the children, and infants, and in differences in probiotics agents, and the differences in dosage. The outcome, we measure the outcome as the mean difference in SCORAD score change, and the pooled mean difference is minus 4.6, favors the probiotic group, with a 95% of confidence interval, and it shows statistically and clinically significant results. However, it is only in the adults group. But you can see tendencies in the children, but the sample size was too small. My other results, the other comparisons, the postbiotics, symbiotics, or the prebiotics group showed no significant results. So this means that probiotics is the most effective microbiome modulation in our study. So the preliminary conclusion would be probiotics are effective as an add-on treatment in adults with AD and should be considered using it in the clinical field. But more research are needed regarding to the symbiotics, postbiotics, or the prebiotics. The strengths of our articles were the high level of evidence, there were all RCTs, and the novel therapeutic focus, and the broad intervention spectrum, but the limitation was the small sample sizes, the heterogeneity of the interventions and formulation, and the short follow-up duration. It was between 8 and 12 weeks. This is my progress of my first project. We almost received all the figures, and the quality of life and the adverse events is under analysis. Let me move to my second project, which is investigating the efficacy and safety of topical calcineurin inhibitors in immune-mediated skin diseases with an international survey. Immune-mediated skin diseases like AD, psoriasis, vitiligo. The first-line treatment of AD is corticosteroids, and it is most widely used, almost 90% of the individuals using this. Because of the side effects, we considered using alternative therapies like calcineurin inhibitors. Calcineurin inhibitors and immunosuppressants, and it is a second-line treatment of AD, but only 20% of the patients using this. It has two main active ingredients, the tacrolimus and the pimecrolimus, and they are frequently used as off-label. It comes with some benefits, like not causing atrophy, and you can use on sensitive areas like on the eyelids, but comes with challenges for their photosensitivity, their compliance issues because of the burning sensation, and it has a theoretical but unproven increased risk of skin cancer. So our aim is to evaluate the efficacy and safety of topical calcineurin inhibitors in immune-mediated skin diseases. The question would be, are calcineurin inhibitors effective and safe in the treatment of immune-mediated skin diseases? To answer this question, we are using the PEO framework, and the P represents the patient with immune-mediated skin condition using topical calcineurin inhibitors, and the outcome would be the change of the disease activity, the adverse events, or the compliance. So we hypothesize topical calcineurin inhibitors are effective and safe in the treatment of immune-mediated skin conditions. And if that's true, then we can extensively use in this disease. We will collect data from the experts and from the patient about the opinion on the treatment effectiveness, the satisfaction with the outcomes, the impact on quality of life, the treatment duration, the alternative treatment option, the concern about the treatment, and the frequency of the follow-up. To summarize, we are planning to submit my first project in September this year, and my next project next year, May. I want to end my presentation with a quote from Carl Jung, where your fear is, there is your task. Thank you for your kind attention.
My question is regarding your first project, where you said that probiotics are effective in the treatment. In what form were they used by the patients? Is it a tablet they need to take, or is it a cream that they can apply in the affected areas?
Thank you for your question. We collected data from systemic and topically used microbiome modulating agent, but yes, in topically they used as a cream formulation, but there was a few articles from it, and the others are used as a powder of a probiotic collection of the bacteria.
So your analysis includes all kinds of, all types of administration, right?
Yes, we include all of them.
Okay.
Yes.
Thank you very much.
I was wondering if you can expand a bit on the clinical significance of your results, because I saw that the SCORAD score is somewhere between 0 to 100 and something, and your result shows that there's just a -4 decrease. Then it seems not so much.
Thank you for your question. Yes, -4.6 point reduction seems modest, but it is in the clinical field, it is an improvement, especially when a patient has moderate disease, and it can reduce the SCORAD score to a mild disease.
I think regarding the probiotics, there is a very heavy, misunderstanding in the literature, because there are two groups, I think. So one who recommend, one who says there is no effect. So I was wondering, did you investigate which probiotics were the mostly used in these studies, or did you do any subgroup analysis?
Thank you for your question. We included all probiotics. We didn't do a subgroup analysis under the probiotics group. We just separated the microbiome modulation agent to the probiotics, pre, syn, and postbiotics. But under the probiotics, there wasn't any subgrouping because they were using different kind of agents. Some were only used lactobacillus, and the other was a mixture, so we couldn't do subgroup analysis.
Yeah, that's why I'm asking, because it would be very interesting if we know
Yes.
which has the most and the biggest effect in these patients. And I have another question regarding the antibiotics. Did you perform any analysis of this, because they might worsen the symptoms?
Thank you for your question. We were searching for antibiotics as a microbiome modulation agent, but as I found that antibiotics only were used when there was a secondary infection and not for treating atopic dermatitis disease, so we couldn't include it.